Welcome to the AAOE series Strategic Conversations, which brings together thought leaders in healthcare management and policy to discuss the critical issues affecting AAOE members. Today's issue, big data and its implications for quality outcomes. As AAOE prepares to launch its data warehouse in 2018, the need for understanding the importance of data collection and analysis is on everyone's mind. I'm your host, Cecilia Sepp, CAE, and I'm pleased to be here today with two leaders in healthcare policy and practice management, former Utah Governor and former Secretary of Health and Human Services, Mike Leavitt, founder of Leavitt Partners based in Salt Lake City, Utah, and Jan Vest, CEO and founding board member of the Signature Medical Group, the largest independent physician-owned multi-practice specialty in the state of Missouri. And Jan is also a past president of AAOE. Welcome to you both, and thanks for joining us today.
Thank you.
Thank you.
So Governor Leavitt, what is your take on the implications of data on healthcare policy today?
Well, data, of course, is a means by which we can reconstruct our behaviors. And by reconstructing behaviors, we can, in many ways, be predictive of the future because our past behaviors tend to be replicated in our future behaviors. And now with big data and cloud computing and the ability to do it to gather and process data in such a rapid and efficient way, the whole area of artificial intelligence is playing into now what's beginning to align with payment structures, where we're beginning to pay more for people who can produce legitimate value. And if you can not just produce it, but demonstrate it, then you're going to get paid more and paid more fairly, and society comes out better and the outcomes come out better. So that's the primary benefit of it, and that's why people are so excited about it.
So Jan, what is your take on the governor's comment?
Well, I couldn't agree more. I think all of us who have been in the healthcare industry and the industry itself realize what a great power being able to do analytics from a large sample of data, and how much that helps to standardize operations in a clinical practice and give physicians just such more insight into treatment plans and utilization of services for the benefit of patients. So it really is an exciting time to see the technology applied across the breadth of healthcare, and the data repository that AAOE is creating is going to make it possible for the members of AAOE, which a lot of them are smaller practices, be able to benefit from the accumulation and the tools that are going to be developed for accessing outcomes data for their patients in their markets.
Those are great applications for today, but the governor mentioned something that really caught my attention: artificial intelligence. And I don't think we've even begun to scratch the surface in that area. How can artificial intelligence be part of the movement to finally have data-driven analysis and outcomes in healthcare policy?
Well, I think that obviously what's going to happen with this data and the analysis and critical thinking of practitioners and the use of artificial intelligence, they will much more quickly be able to identify best practices and also be able to apply innovations more quickly, because they'll have access to a large pool of clinical research that they can get real-time information from. And artificial intelligence is a great help in that area because I know I've seen some demonstrations of the IBM Watson product, which makes it possible to go through 22,000 research articles or literature search in minutes, where it used to take weeks and weeks to do that by researchers.
Oh, thank you. That's a great comment on that, on the artificial intelligence. That's great. So we've touched on the importance of data analysis for outcomes and changing our behaviors. But we're living in a world that it's 24 hours all the time, everywhere. It's not just New York, New York anymore. The whole world's 24 hours a day, 7 days a week. So we're living in an era where data is everywhere and it can be overwhelming. So how does a data warehouse alleviate stress in a data-driven world? Governor, would you like to address that?
Well, I think the interface with data, there's really two aspects here. One is how do you accumulate it in an efficient way? And the second is how do you access it in an efficient way? A small medical practice would have a very difficult time developing the infrastructure on their own to accumulate data that was relevant to them and having enough scale that what they do is relative or comparable to others. And by pulling this all together into this large database, AAOE is doing a real service, in my judgment, to not just small practices and medium-sized practices, but the country as a whole. I mean, it's evident to me this will become the largest repository of data on orthopedic procedures that the country has, and it will benefit many. So that's the accumulation on an efficient basis. Then I'm sure the association is going to begin to work on ways in which it can be accessed quickly. We've talked a bit about artificial intelligence, but we've all used this. I pick up my phone and you might be asking Siri, or you might be asking Google, or you might be asking Bixby, whichever phone you have. But in essence, what you're doing is accessing big data that it's able to sort through and produce an outcome for you. And I can see surgeons, as they plan a surgery, being able to literally verbally ask questions and not only look at their own behavior, but how it has begun to, how it is compared with other surgeons who are doing common things, and the quality will go up as a result of that. And obviously, if quality is going up, outcomes will be better.
That's a great point about we all live in big data and use it without realizing it. So Jan, how does that apply to the daily practice for an orthopedic administrator?
Well, one of the activities that's going on right now is this transition to value-based contracting and value-based care. And in order to be able to impact clinical outcomes and improve outcomes, you have to give physicians real-time information about the outcome of their treatment plans and the outcomes and the performance of their collaboration partners in a bundle payment, for instance. So the big data will make it possible for, in the repository of big data will make it possible for our members and other orthopedic and the nation really to see what practice protocols and workflow processes get the best outcomes and reduce adverse events for patients, so that we all have access to information that helps reduce readmissions. We all have information to help each provider that's part of a bundle or part of a collaborative care model, the best information in real time, as fast as we can get it, so that we speed up the feedback loop, so physicians who are practicing in real time have access to the most recent innovation and best practices.
Wow. Okay, that is great. A great summary of that and very easy to understand. So we've talked a lot about the quality outcomes and why AAOE is doing this. But then it sounds like, based on the conversation so far, data warehouses are going to grow across the country in specialty areas, whether it's orthopedics or cancer research or whatever type of practice a physician might have. But what's the most compelling reason to create and maintain a data warehouse? Because as you've both touched on, collecting data is easy. Analyzing it and making sense of it is not necessarily the same case. So Jan, would you like to continue with that?
Sure. Well, for orthopedic practices, and in my case, and most of the AAOE members are in private practice. These are small business owners or medium-sized business owners who have been really struggling with the cost of providing services and the heightened regulatory costs associated with the Accountable Care Act. And some of those costs provide good benefit to patients, like the MIPS program, which is a quality enhancement program. But in order to qualify for that, you have to have the infrastructure available to be able to help your doctors get the 5% incentive compensation. And otherwise, there's a penalty for you. So it's AAOE and their data warehouse project is going to be the most cost-effective access to quality reporting and outcomes data for those practices, so that it won't be such a cost burden on them as they continue to have to transition their administrative costs and their workflow costs to this value-based environment that we're in.
Well, and that's a great segue back to you, Governor. Leavitt Partners focuses on healthcare value economy policies and practices. So how does that follow with what Jan was just talking about?
Well, simply stated, the world is changing. It's changing over time. It doesn't happen overnight, but over the course of a decade or so, physicians are going to be paid differently. And in my mind, this is literally a survival matter. For small, medium-sized practices to be able to be paid and be competitive in the world that's coming, they need to have these kinds of facilities. And the healthcare world is not alone in this. I mean, there's a lot of people who have owned hotels, but if they're without a reservation system, they are left out of the way the world works in that industry. This is a way in which, in the healthcare world, if you're without the capacity to have analytics of the type that this will produce, it will be very difficult to contract in the future with those with whom we currently contract. So this isn't just a nice to, this is a have to. And the nice part is they've got a bit of time to adjust, to build this, to learn how to do it. They're not alone in it. Everybody's trying to figure this out, but I think this is a very forward-leaning, visionary thing that AAOE is doing, and their members should be extraordinarily enthusiastic about it.
And that's a great bridge, Governor, to our next topic, which is the practical application of data to business strategy. Because as we all know, we've all worked in the healthcare policy area for a number of years. It is still a business in the end. We want to deliver good care. We want to have quality outcomes, but there's still a bottom line that needs to be addressed. So, Governor, how can we apply this data well to developing a business strategy in this changing environment where payment is just completely different?
Well, let's just begin with where I left off before. Currently, if a orthopedic surgeon wants to make more money, they work harder and do more surgeries. In the future, if they desire to do better, as payment rates continue to be pressed down because of very serious global economic pressure, excuse me, they will need to be part of demonstrating that the value of the services they provide actually are making patients better, and they are comparably able to do that. And this kind of data will be necessary for that.
So building on that, on what the Governor just pointed out, Jan, how does that apply to developing a business strategy that's going to grow the practice, make it more successful, and find more patients within this constantly changing payment system?
Well, I think it's a really a perfect segue what the governor mentioned, because one of the things that's happening in healthcare, and I think personally it's a great thing, is that the competition that's going to be helping improve outcomes, and also to create that competitive tension, so that providers have to improve, have to be able to use innovation to help their patients get a better product at a better price, and also being able to eliminate waste from the delivery of the care. We know from the Institute of Medicine study that 30% of all services that are provided in our healthcare system today are unnecessary and wasteful. But in order to verify those that are the best practices, we have to have data to show the evidence to support those findings. And that's what is going to happen in the future for practices. Competition is going to, I think personally, is going to save our healthcare system and make it possible for our grandchildren to have access to Medicare and have access to good quality care. And also competition will make it possible for us to increase access because we're better utilizing resources, and we're better stewards of the resources that we have.
So competition is going to be key in the future. And in order to be competitive and create the new strategies that are necessary in that environment, we're going to need to translate the data. So Jan, I'm going to have you continue with this next question. What are suggestions for translating data into decision-making processes?
Well, I can just tell you that in my experience and Signature's experience in two programs we have that are really data-driven programs. One is our Strong Start program, our maternity care program, which is a women's health program for high-risk Medicaid moms. Our whole goal with that program was to reduce preterm deliveries. And in order to do that, there are multiple data points that our care team have to collect in order to identify best practices and intervention strategies to help women access prenatal care, provide them transportation, and also get them to the right care path at the right time. The same thing is true with our bundled payment for care improvement program, where we are clinically integrated with about over 2,000 orthopedic surgeons across the country. We take data every month on performance and report that data back to each one of those physicians in a format that they can use that data to see what their outcomes are and how they can change practice and care design to get better outcomes and reduce adverse outcomes or adverse events for their patients. There's nothing more important than data for decision making. It's as simple as we do that every day with critical thinking, but in order to do the best critical thinking, you have to have access to data from which to make a decision.
Well, and I think critical thinking is a great segue to throw that question over to the governor on suggestions for translating data to decision making. Critical thinking is something we don't necessarily talk about unless we're having conversations like this. So, because we're in the middle of our day. So, Governor, what sort of advice might you have for people to take data and then use it to make decisions? How do you overall get it into a decision-making process?
Well, I do want to underscore the point. We started off talking about how important this is to the business model, but the truth is I don't know many physicians who got into medicine without the aspiration of wanting to heal people and to make them better and to produce the very best quality outcome they can for patients. And I know that physicians are constantly working to find ways to improve their skills. But it's true for physicians, as it is everyone, that sometimes we get into a kind of small world and think that we're seeing the totality of the world, when in reality it's a much bigger sphere. And by looking at data, we're able to compare what we do with much larger universes of people. And if we find out that our outcomes aren't as good, then it causes us to want to ask the question why. Or for that matter, if people find out that ours is better than others, it gives us an opportunity to share. The reality is big data is about being able to collaboratively improve the state of the science and the state of our individual performance. And I am sure that, that the AAOE data will allow physicians to look in very critical ways at their own data to make certain that they're performing to the standard that they are satisfied with. Now, they should know, and won't be a surprise, that those who pay them are going to be looking. And so it's a pretty good idea for them to look at themselves in advance of that to be able to improve.
Yes, and you actually reminded me of a quote I found preparing for our conversation today by Lori McGraw, who's the Senior Vice President of Health Solutions at the American Medical Association, discussing their recent data initiative. And this follows very closely with what both of you have said. What came out of that study is that what physicians value most is caring for patients, and anything that gets in the way of that is effectively a burden to the physician. And one of the things that is in the way is not that there isn't available data, but it's not well organized. And I think that that is something that leads us into our next question about data warehouses and how they organize data. And how does a data warehouse support healthcare delivery? I think Jan gave us a great example of delivering to prenatal. How could that, what is an example in the orthopedic specialty of improved healthcare delivery from using a data warehouse? Jan?
You asking me? I will just tell you that we're seeing this throughout the entire health sector, not just in orthopedics. But for example, a hospital system I'm aware realized very clearly that that the moment in time when they administer antibiotics has a big impact on the actual outcome and the number of infections. So it's being able to use this as a research tool to come to those conclusions and help physicians know how to improve their practice will be an important outcome.
Excellent. And Jan, what is your take on that?
Well, I think that, you know, knowing the health status of a patient before surgery and having a large repository of physicians' care plans that research can be done on can, again, provide care plan redesign opportunities so that physicians across the country have access to the best innovations for getting better outcomes of surgery. I mean, I can tell you that some of the things that we've discovered in the data repository that we have at Signature are very simple improvements that we would not have been able to identify without having clinical researchers do real quick studies to find out, you know, why a particular bandage after surgery reduces readmissions, because it reduces infections, and then communicating that to our care collaborators in post-acute care facilities so that they can take that clinical information and immediately apply it and reduce the infection rate after surgery and prevent an unnecessary readmission for that patient, which costs $20,000 plus the stress on the family and the patient, and just strain on the entire healthcare delivery system. So it really, that data and continuous flow of the feedback loop makes all the difference in the world. In terms of improving care, reducing costs, and having a competitive advantage as a provider in whatever market you're in across the country.
So Jan was just touching on metrics and how patient metrics and metrics related to outcomes can help improve quality. So how does building this big warehouse across many practices, across a specific specialty, help patient metrics across the board?
Well, the bigger the data, the more accurate it is, the more accessible it is, the more helpful it is. And by bringing this data warehouse together and providing the AAOE membership with those tools, it will not just help, it'll revolutionize their practice as the world makes these changes at the same time.
Jan, and your thoughts?
Well, and also I can, in a medical practice where we are being reviewed by the payers all the time, it's always better if you have the highest level of knowledge to defend your physician's decision making. And I think that I can give you several different examples of the audit process that goes on between, an insurance company and a medical practice about medical necessity of surgery or a certain surgical approach. And it always comes down to their medical director talking to the practicing surgeon and having access, supporting documentation about a surgical procedure and the surgical approach and why that was chosen for this respective patient is a lot easier when you've got access to the information that's going to be available from this data repository. And from a cost standpoint, I've already seen instances where we've done studies out of our repository where we can get a sample size of 10,000 patients, and which is a sample size that no university has access to. But we can do those kind of research projects very quickly because we have the repository that Signature has. Now, AAOE has the opportunity to, as the governor said, be the largest orthopedic repository in the country and impact the largest number of practicing orthopedic surgeons in different markets across the country, both urban and rural, and large hospital systems and small hospitals. So it really will be the standard, I hope, and I think it will be in the industry once we get the data into the repository and once we have the analysts and the researchers putting together the tools that will make this quick turnaround research available to develop evidence-based strategies for all of our members who are participants.
So talking about practices and people participating in the data warehouse, and AAOE is geared toward the orthopedic practice administrator. So Jan, we're going to throw this to you first. So how is a practice administrator's perspective beneficial when it comes to data collection and analysis in quality healthcare outcomes?
Well, it's amazing in my life, in my professional career, how the administrator of an orthopedic practice's work has changed. It used to be that we were a staffing manager, a purchasing agent, a managed care contracting person, and just like a team coach. Now, that administrative position has to interface with Medicare in different ways, has to interface with other payers in different ways, and also help the physician and the physicians in the practice organize their service line to participate in alternative payment methodologies with Medicare and also with commercial payers. And so the role of that administrator is going to continue to change as they interface and learn these new skill sets to use clinical data and help the physicians with their clinical data to sell their product and promote their product as a high quality, high performing practice. Data is absolutely a requirement. Continuous quality improvement is going to be absolutely a requirement in this new competitive world that we're in. And administrators have already begun to learn those skills, but this new data repository will be a big step forward and a support for them to improve those skills as going forward.
And Governor Leavitt, what is your perspective on the changing role of the administrator from where you sit?
Well, I think Jan mentioned the fact that practices are have to become more sophisticated. In large measure, that's as a matter of survival. It's not a straightforward contract with every insurer kind of world anymore. It's actually negotiating not just for payment rates, but also for patient access. In many situations, without this, people will find themselves without patients, let alone without payment. So that's part of the role of the administrator. A doctor wants to heal and repair. They don't want to spend their time negotiating with insurers. And I think the role of the administrator has been to help them find their way through the requirements to become increasingly sophisticated and to fit into the new value economy. And I think that's, again, one of the ways that this AAOE database is such an important tool.
Well, Governor, as we're winding down our strategic conversation about big data and its importance to healthcare outcomes, what do you think is the most important reason for AAOE members to participate in this new data warehouse?
Because it paves the way for their continued mission, practice, and economic prosperity. It's as simple as that. Without access to this kind of data, without access to this kind of sophistication, it will be extraordinarily difficult for small and medium-sized practices to survive. And I think this is an important step, not just for the survival of businesses, but for the management and improvement of care. If a physician desires to be at the top of his profession in terms of the kind of care that he provides the patients who trust their lives and quality of life to them, then they'll want to use these tools.
And Jan, what do you think is the most important reason for AOE members participate in the data warehouse?
Well, I think, just to echo what Governor Leavitt mentioned, it is going to be a requirement to succeed financially in the future. And the world continues to change. The demands on the practice administrator and on the practice that they represent are going to continue to grow. And this data repository is an opportunity for all of our membership to come together and work on a platform that will assist all of our practices in improving care, reducing costs, and helping to maintain each one of our membership practices in this new competitive world. We'll be able to actually impact the better outcomes for our patients. We'll be able to actually reduce costs for the healthcare industry. All of those things are just extremely important for the country and for our practices and for the profession of orthopedic practice management.
So the data warehouse at AAOE sounds like it is going to not just be part of the future, but setting an example for others to follow.
Absolutely, absolutely. I think that we'll see it in all subspecialties, and I think that we'll be happy that we were one at the tip of the spear, so to speak, to lead the way of organizing clinical data and making that available to all of the practices across the country in a cost-effective manner.
And as we wind up our conversation, Governor, did you have a closing statement you would like to make about the importance of big data going forward?
Well, I often give people the following advice. Change is upon us, and they really only have three choices. They can fight it and die, because they'll be overcome by new business models that provide better quality at a lower cost. Or they can accept it, have a chance if they go along, or they can lead it and prosper. And I think this is an example of how the membership of AAOE can lead and prosper. Now, there'll be a point where this is no longer leadership, but it puts them, but that it's an essential. And I'm delighted for the fact that it's happening, because it'll make American medicine better.
Thank you, Governor. And Jan, would you like to make a closing statement?
Sure. I just want to, again, thank Governor Leavitt for participating in the conversation today, and really appreciate his remarks. I think that it really is an opportunity for membership, for our supporters, our vendor partners across the country who help support AAOE at our national conference. I think it's going to be important for all of those entities that are part of the orthopedic industry to organize around, support, and make a big difference for all of our country and in the orthopedic world. We know that we've already had an impact with our benchmarking survey. We know that we've had an impact with AAOE over the last 25 years. And this is just a continued part of a constructive evolution of the power of AAOE, and this data warehouse is probably the best example of constructive collaboration in the face of change in our industry.
So big data, big topic, big outcomes, and is of crucial importance today. I would like to thank our guests, Governor Leavitt of Leavitt Partners and Jan Best of Signature Medical Group, for joining us today and sharing their long experience and strategic insight into this area. Watch for AAOE's next strategic conversation. I'm Cecilia Sepp. Thank you for joining us.